Advancements. In this present era, we human beings are running behind advancements. Every field has got its own advancement, and today, dentistry has advanced to its core in all aspects. Hello, everyone. Myself, Dr. SINJU Paul, presently working as an assistant professor in the Department of Conservative Dentistry and Endodontics in Annoor Dental College. So, today I would like to lecture on a very simple topic, that is recent advancements in composite restorations. And in exam point of view, this is a very important topic for postgraduates as well as for undergraduate students. And I know theoretically it's a dry topic, but I'll make sure it will be interesting. So let's move on to the lecture. Recent advancements in composite restorations include packable composites, flowable composites, indirect composites, antibacterial composites, nano composites, compomers, Sylloring composites, stimuli responsive composites, fiber reinforced composites, and self healing composites. Direct composite resins. It includes condensable or packable or polymer rigid inorganic matrix materials. So the components include resin matrix and inorganic ceramic component. So normally in a composite, the filler particles are incorporated onto the matrix, whereas in packable or polymeric rigid inorganic matrix material, here the matrix is incorporated into the filler component. So the resin is incorporated into the fibrous filler network. It consists of aluminum oxide and silicon dioxide glass particles, barium aluminum silicate, and strontium glasses. So the mechanism is that the glass particles are liquefied to form a molten glass, where it is forced through a die to form thin strands of glass fibers, and the diameter of these glass fibers is 2 to 3 micrometers. So an important process occurs, that is siliconization. What is siliconization? Glass fibers are crushed into smaller fragments and then reheated to a sufficient temperature to cause superficial fusion, and this is known as siliconization. So what are the properties? Greater depth of cure, low polymerization shrinkage, low wear rate, increased radio opacity, and increased fractural modulus. So as I told earlier, the fibrous network forms small chambers or small cavities, and into these cavities or chambers, the matrix is incorporated. So infiltration of spaces within the fibrous network with resin, and the depth of cure is 5 millimeters. This is the example. Moving on to flowable composite. As the name indicates, flowable composite has got lesser filler content and it has got low viscosity. So since the filler content is very less, that is 56 to 70%, it has got reduced mechanical properties, high susceptibility to wear, a higher polymerization shrinkage, and low flexural strength. And the resin matrix include Tech DMA. It also blocks smaller undercuts because due to its lower viscosity and filler content, it can be very easily incorporated into smaller undercuts. Poor mechanical properties, high fracture toughness, low modulus of elasticity, and the depth of the cure is 6 millimeters, but it's very sticky. Moving on to clinical considerations. In what all conditions a flowable composite can be used? It can be used as a pit and fissure sealant, preventive resin restoration, small class 3 and class 5 low stress areas, liners in proximal box of class 2, can be used for repairing porcelain in composites, can be used in tunnel restorations. What is a tunnel restorations? It's a conservative mode of preparation or preserving a marginal ridge of a tooth. So tunnel restorations, it will be very small cavities wherein it will be very difficult in incorporating normal bulk composites. So since this has a low viscosity, it can be very easily incorporated into such tunnel restorations. Another application is that it can be used as a core builder and cementing agents for porcelain restorations. These are the pictorial representations. See, in this diagram, it shows a tunnel restorations. We can see How small is a cavity? Recently, self-adhering flowable composites has been introduced, which incorporates GPDM monomers, that is glycerophosphate dimethacrylate. Here, the phosphate functional group combines with a chemical bond or forms a chemical bond, that is, it combines with the calcium ions of the tooth. Moving on to indirect composite resin. Indirect composite resin, as the name indicates, restorations made on a die rather than directly on the tooth. So, since a restoration is made on a die, the most important advantageous property is that we get a superior adaptation, contour and proximal contact, wear resistance, aesthetics, marginal adaptation, control over polymerization shrinkage. It's a very important point. We get a control over polymerization shrinkage. So this is an indirect composite resin. Moving on to antimicrobial composite. As the name indicates, some antimicrobial agents are added to the normal composite. So what is the mechanism of an antimicrobial composite? When a microbe approaches an antimicrobial composite, what happens is that antimicrobial agents are released from the composite. At that point itself, the microbe gets killed. Wonderful mechanism. So, introducing agents such as silver or one or more antibiotics into the materials. The microbes are killed on contact with the material through leaching of the antimicrobial agents into the body or environment. This antimicrobial effect lasts for 1 month. So, what are the antimicrobial agents added? Silver and titanium particles, alkylated ammonium chloride derivatives, and chlorhexidine diacetate. Moving on to nanocomposites. As the name indicates, nanocomposites, the filler particles are very small compared to other composites, and it's prepared by three processes: flame pyrolysis, flame spray pyrolysis, and soldier process. And smaller than the wavelength of visible light, unable to scatter or absorb visible light. And the important property of a nanocomposite is that it is highly polishable. Next, compomers. From the name itself, we can know that it includes the properties of both composites and glass ionomers. It is polyacid modified composites. It includes the durability of the composite resin and fluoride releasing capacity of the glass ionomer cements. So composition include resin matrix has UDMA and TCB combined with polymerizable hemoside chains. Setting reaction, it forms a three-dimensional network reinforced by filler particles. So after an initial set, it absorbs water from the mouth. A carboxyl group of the TCB liberates metal cations in the presence of water, forming hydrogels, which further helps in cross-linking. Normally glass ionomers, the compressive strength is 140 megapascal and composite the compressive strength is 300 megapascal. So combining both the effects of glass ionomers and composite resin, compomer the compressive strength comes up to 200 to 250 megapascals. Sylloring composites. It's a low shrinkage restorative material. It combines both the properties of Sylloring and oxirane monomers. So the mechanism is that it uses a photocationic ring opening mechanism. And the composition includes Sylloring matrix, fillers, initiators, stabilizers, pigments in its various percentages. So as I told earlier, it polymerizes through a photocationic ring opening reaction. And a very important property of the Sylloring composite is that minimal polymerization shrinkage, that is 0.9%. This is the photocationic ring opening mechanism. Stimuli responsive composite. From the name itself, we can understand that when a stimulus is applied to the stimuli responsive composite, the entire property of the composite changes. That is, properties can be changed by an external stimuli. It can be any stimuli, that is, changes of temperature, mechanical stress, pH, moisture, or electric or magnetic field. And studies indicates that stimuli responsive composites are very much effective in preventing secondary kills. Fiber reinforced composites. In fiber reinforced composites, the filler components are completely reinforced by fiber contents. So since it is enriched with this fiber components, the main important property of fiber reinforced composite is that it acts as crack stoppers. So there are different alignments of the fibers, that is unidirectional, bidirectional. In unidirectional fiber composites, the fibers run parallel in one direction. And the physical properties are highest in direction parallel to the fibers and lowest in direction perpendicular to the fibers. So these are the different alignments of the fibers in a fiber reinforced composites. A, continuously arranged fiber reinforced composite. In B, the diagram shows discontinuously aligned fibers, and C, randomly arranged discontinuous fibers. This is the scanning electron micrograph showing different architects of fibers available for dental use. Recently, for centuries, man has been searching for a very tough and durable structural material. If we look in our surrounding environment, if we look at the living creatures, we can see that self protection and self defense is not only made from their outer coverings or outer shells. Self protection and self defense is also available from normal healing mechanism of a human skin, as well as the regeneration capacity of a simple tail of a lizard. Using this technology, this inspired the formation of intelligent materials such as self-healing composites. From the name itself, we can understand that this composite has got a self-healing capacity. Automatically, the cracks are healed. So this consists of three main mechanisms, that is, first is capsular, second is vascular, and third is intrinsic self-healing materials. So first of all, I'll be explaining what is capsular self-healing composites. As the name indicates, capsular self-healing composites consist of microcapsule. You can see in the diagrams that round microcapsules, and each microcapsule consists of a healing agent. And surrounding the microcapsule, there is a catalyst. I'll explain once more. Capsular self-healing composite consists of microcapsules, and each microcapsule contains a healing agent. And surrounding the microcapsule, there is a catalyst named as Grubbs catalyst. Okay. So you can see here in the first diagram, you can see a crack approaching the composite. So when a crack approaches a composite, what happens is that this microcapsule gets ruptured. When it gets ruptured, the healing agent present inside the microcapsule combines with the catalyst around the microcapsule, and they together combines and forms a network, and it automatically heals the crack. This is a wonderful, amazing property of self-healing composites. And the second is a vascular component. It is similar to that of the capsular component. The only difference is that here microcapsules are present, there vasculatures are present, and these vasculatures also contain healing agent, wherein when a crack approaches, the vascular component get ruptured, the healing agent moves outside, combines with the catalyst, a polymerizing network is formed, automatically heals the crack. Coming to intrinsic self-healing materials, here the mechanism is completely different from capsular and vascular components. Here, intrinsic self-healing materials heal through inherent reversibility of the chemical or physical bonding. Here, what happens is that there occurs swelling of the polymers, melting and solidification of the thermoplastic materials, and increasing viscosity of microgels. So, with this, I'm concluding my talk on recent advancements in composite restorations. So, see you next time with a different topic. Till then, goodbye.